Hey, I'm going to tell you something that your doctors probably won't tell you straight out because they're afraid you'll see, or maybe they just don't want you to really understand what's going on in your body. But I'm not like that. I believe that information is power, and you have the right to know what's really going on down there when things start to get weird after 60 years. So listen carefully because what I'm about to reveal here could literally save your sex life, your health, and even prevent serious complications that are rarely talked about, but are more common than you think. If you're experiencing that strange thing where you feel like you're having an orgasm, all the sensations of climax, but at the same time nothing comes out or very little, it's like just a few drops that barely exist. You're not alone and not alone. It's not normal aging, as some doctors say, so it's easy to say goodbye to you and end the consultation. I'm Drea Lara Cruz, and today I'm going to reveal the whole story about retrograde ejaculation, guys. Hormonal problems and other conditions that can be the reason why your body just surprises you in ways you don't want. But before we really get started, I just want to ask you one thing that will really help this content reach many others who need it but don't know where to start, if you think what I'm saying makes sense. Hit the like button because it shows the algorithm that more people need to see it. Subscribe to the channel because every week I have this kind of content. Straight, no frills, and no pretense. And comment your city or country because I'm so happy every time I see messages from different places. It's great that we are connected all over the world on issues that are really important to health and quality of life. Now, let's get straight to the point because time is of the essence and your health can't wait. When you ejaculate but no semen comes out, the first thing you need to understand is that there are three main culprits here. Retrograde ejaculation is when semen travels to the bladder from the penis out of the normal path. Physical blockages that block the path of semen and hormonal or medication issues that literally dry up production. Retrograde ejaculation is like taking the wrong turn while driving and suddenly going the wrong way in your body. The semen is sent to the wrong place because the bladder sphincter, the muscle that should close during orgasm to direct it out, is no longer working properly. What are the most common causes of this? Poor diabetes control, prostate surgery, high blood pressure medication, especially alpha blockers, and even some of the medications for mental problems. Those with diabetes should be very careful because prolonged high blood sugar levels damage the nerves over time. When the nerves that control the bladder sphincter are damaged, this is the perfect recipe for retrograde ejaculation. Mang Eduardo has a patient here at the clinic. He is 63 years old. He was so worried that he thought he had serious cancer because his sperm suddenly disappeared. When we investigated, it turned out that he had diabetes for 15 years, but was not being treated seriously. His sugar was very high and his nerves were damaged. If you have had prostate surgery to remove a tumor or that benign enlargement that makes urination difficult in adults, you should know that it changes the structure of the pelvic area and can affect the sphincter. It doesn't always happen, but it's common enough that you wouldn't be surprised if it were you. And the medications, my God, the medications are a different story because they rarely tell you the side effects properly. You are given blood pressure medication. You take it happily thinking you are taking care of your health. Then suddenly the sperm decides to go on vacation forever. Alpha blockers like tamsulosin, doxazosin, and others ending in icin is famous for causing this. And it's funny that it's given to help prostate problems and make urination easier. But it changes ejaculation. If you're taking this medication and have this problem, don't stop on your own because other conditions may get worse. But you should consult a urologist to see if the medication can be changed or adjusted. Now let's talk about physical blockages because there are times when the problem is not the wrong way, but the passage is literally blocked. Infections, chronic inflammation, scars from previous surgeries, or even from previous diseases that you thought were gone but left a scar inside. All of that can cause blockage in ejaculatory downs. It's like a clogged pipe in the house. The water wants to come out but can't. The same goes for semilya. Dad Ramon has a patient here. He had gonorrhea when he was young, which was the medication before, but it left a scar inside that got worse as he got older. At 65 years old, there's almost a total block that prevents sperm from coming out. This is rarer than retrograde ejaculation. But when it happens, it sometimes needs to be treated with a procedure to reopen the passage or anti-inflammatory medication if it is still early puberty. And there is also the problem of low sperm production due to hormones. or because the prostate and seminal vesicles are working slowly. Low testosterone is very common after 6, and when that hormone drops significantly, sperm production also decreases. Testosterone is not only about muscle and libido, it is also important for the production of seminal fluid. So when it is low, it is as if the entire reproductive system enters energy-saving mode. In addition, with age, the production of fluid in the seminal vesicles naturally decreases. The prostate may grow, but its secret also decreases, so the volume of ejaculation gradually decreases. But notice that the gradual decrease over the years is different from the sudden loss of sperm. The second scenario always needs to be investigated because it could be a sign of something serious. So what should you do immediately if you are experiencing this? First, make an appointment with a urologist without hesitation. Don't put it off because you are embarrassed or think it is just a small matter. The doctor will ask for a urine test to see if there is semen in the bladder after ejaculation. If there is, it is confirmed that it is retrograde ejaculation. An ultrasound will also be done, possibly blood tests for hormones, blood sugar, kidney, and liver function. Everything to build the whole picture. Second, review all the medications you are taking with your doctor. Bring a complete list. Don't forget even one. Sometimes the solution is to simply change the medication to one that does not have this side effect. Third, if you have diabetes, now is the time to seriously control it because it is more difficult to repair damaged nerves than to prevent damage. Keep your blood sugar strictly in the right range. Fourth, if the problem is hormonal, testosterone replacement may be an option, but it should be evaluated carefully because there are risks and benefits that need to be weighed according to the individual. And another thing I have to say is to be honest. Many men are too focused on appearance or ego to see the semen coming out that they forget about their overall health. If he has retrograde ejaculation, but his orgasm is normal and his sex life is okay apart from that, and you don't plan on having children because he's past that phase, technically, it doesn't directly affect your health. It's more an issue of how you feel about it, but don't ignore it because the real reason behind it, like uncontrolled diabetes or a side effect of medication, that needs to be treated. But if in addition to no semen, you have an illness, difficulty urinating, blood in the urine, erection problems, or any strange symptoms, that's serious and needs an immediate checkup because it could be an infection, serious prostate problems, or other conditions that needs to be treated immediately. Kuya Miguel came here with a complaint of dry ejaculation. When we investigated, it turned out that the prostate infection was advanced. We treated it with antibiotics for a few weeks and it resolved. But if he'd waited longer, it could have gotten worse. So don't ignore your body's signals, especially if the change is sudden. If your ejaculation was normal before and then suddenly changed, your body is screaming that something else is happening and needs to be investigated. It is also important to know that the process of ejaculation and orgasm are separate. You can orgasm without ejaculation, and technically, you can also ejaculate without orgasm. The nerves and mechanisms are different. So when you have an orgasm but no semen, the nerves for pleasure are working, but those in charge of releasing or directing the semen failed. This is good to know because many people think that if there is no semen, it is not a real orgasm. But that is wrong. It can still be full of pleasure even without semen. In conclusion, I want you to understand that this is not a trivial matter. No offense. This is just health straight up. The more you know about your body and the more open you are to asking for help, the better your quality of life will be. And since we're done with this conversation, let me repeat the request from earlier. If this video helped you, if you learned something new or confirmed your suspicion, hit the like button so more people can see it. Subscribe so you don't miss the next content where we continue to discuss health things that everyone needs to know, but rarely talk about tomorrow, and comment where you're watching because I really want to know that this knowledge reaches different corners of the world. Take care of your health. Don't let shame or fear stop you from asking for help, and remember that knowledge is power, especially when it comes to your own body. A hug, and until next time.